much, Wendy, and good afternoon, everybody. And it's equally miserable in Wigan, where I'm based at the moment. So I'm going to talk about brachycephalic patients today. The majority of this we're going to focus on dogs, but some of this will be applicable to cats, but cats don't tend to suffer, although we get brachycephalic cats, so Persians, things like that, they don't to the same extent have the same issues as we see in our brachycephalic dogs, so typically our bulldogs or pugs or things like that. So I quite enjoy dealing with brachycephalic patients. We definitely see them more of them in our clinic. We seem to have a pug more or less every day that's in with us with aspiration pneumonia or a French bulldog. So we're definitely seeing more of these cases and dealing with issues that they get, sometimes relating to anaesthesia. And so these brachycephalic breeds have got, we're all familiar, they've got these anatomical considerations that may affect anaesthetic outcome. They're going to some extent, all going to suffer some brachycephalic airway syndrome, and that's characterized by those narrow nostrils, that elongated soft palate. They can also get things like everted laryngeal saccules and hyperplastic tracheas. So they've got much narrower upper airways than dogs would do with a normal anatomy. And because of this narrow airway, we get anaesthetic-related problems, and this is what we're going to talk to you through today. We're going to look at every aspect of anaesthesia in these patients, what we can do to give these patients a better outcome, all the way through from, pre-anaesthetic assessment to pre-meds to induction to post-operatively, look at every aspect of these patients' care. So brachycephalic airway syndrome, we've kind of talked a little bit about already. The primary components are those small nostrils, that longer soft palate, that narrow trachea, and that narrowing of the airway all increases the work that these patients have got to do. It causes increased negative pressure, and it's that increased negative pressure that will lead to secondary components of this brachycephalic airway syndrome. So we can get everted laryngeal saccules, laryngeal collapse, and everted tonsils, which then itself will further narrow down that airway, just compounding the problem and adding into it and making them, more problematic, from in day-to-day life as well as under anaesthesia. And we get those clinical signs that we're familiar with in these patients, that stertor, that upper airway noise that we associate with those brachycephalic patients, that noisy upper respiratory tract breathing. They tend to have an inspiratory dyspnea, so what that means is they've got a much more prolonged inspiratory time. That narrow airway is going to take longer to get that breath in, so typically we'll see these patients have that really prolonged inspiratory time compared to expiratory time. They'll tend to have an exercise intolerance when we do get the odd sunny day in Manchester. These are the types of patients that we're going to get in with a heat stroke. We can see them with collapse episodes, and also they can get gastrointestinal tract issues associated with being brachycephalics as well, and we'll touch on that later on when we're looking at what agents we can use in our anaesthesia. And these patients, as I'm sure you're aware, do have a tendency to be slightly more overweight than others, so these problems are further compounded because they will get worse as these patients become heavier. So this is what we talked about, that reduction in airway diameter, the associated increase in upper airway resistance, that greater negative intrathoracic pressure. You get these dynamic pressure changes that are going to increase that airway resistance and cause that inflammation, that edema of all those pharyngeal tissues, and we get those side effects, those issues associated with it. And this just demonstrates how narrow these patients' upper airways are. We can see this is a dog after having surgery to widen this dog's nostrils, and we're doing these procedures more and more commonly now. Things like trimming back those long soft palates, widening these nostrils. We're trying to open up these airways as much as can. I'm not going to go into surgical techniques too much. If anyone wants more information, I can happily email you anything extra that I talk about today if you think that will be useful to you. And what we want to do with these patients, having done my American VTS, I look very, at patients undergoing anaesthesia, irrespective of breed, very differently. I think about what can I do with this anaesthetic to do the very best for this patient to get the best possible outcome. So as a nurse, I'm going to do a preoperative assessment of that patient, and the same equally will apply to vets. We're going to do a major body system assessment first. We're going to focus on the cardiovascular system, the respiratory system, the nervous system and also the hepatic and the renal systems? Are there any issues in those organ systems? Do we need to investigate further? So do we want to do some laboratory tests for these patients? So typically we'd look at doing complete blood counts, biochemistry, urinalysis, blood gas analysis as we've got it available. So what we're trying to do is determine in these patients, is there any disease process that is going to affect our anaesthetic in terms of the uptake of drugs, on those drugs' action, the metabolism of those drugs, how they're eliminated from the body, and how safe that anaesthetic will be for that patient. And predominantly in these patients, it's going to be the cardiovascular and the respiratory systems that, out of that major body system list, that are most likely to be of concern and we're most likely to have issues with. And I'm going to look at the history for that patient as well. So I'm going to look at the animal's health status. I'm going to have a look back on their clinical history. Is there anything that, would cause me to be concerned about, has that patient had, a cough recently? If so, how long has that cough been going on for? How severe has it been? How, its duration? What associated symptoms did we get with that? So for any different health conditions, we would look to questioning the owner more about this or looking further into that patient's clinical history. Has that animal potentially had exposure to any drugs? So has it been placed onto any medications by a vet? I also will question owner, have they give that animal any medication, so human medications that they've prescribed themselves? So has that owner decided that that dog was a little bit stiff getting up recently and so they decided they were going to give it some ibuprofen? We want to make sure we know about it, and that's why we're very specific about asking about both veterinary prescribed and owner prescribed drugs. We'll check things like, has that animal had a pregnancy, and also when was that animal last fed? We'll talk about this later on, but we don't particularly want these patients having very prolonged fasting times. We did an anaesthetic on a patient last week, and that dog, when it presented in the morning at 8 o'clock, hadn't been fed since 5 a.m. the previous day. Now that for me was far too long for that animal to have been starved. We'd rather at that point give that animal a very small meal, literally a tablespoon of food, so the contents of that animal's stomach are not too acidic. We want, if that animal stands a risk of regurgitating and aspirating stomach contents, we'd rather it be slightly more alkaline, cause slightly less damage, and also the risk of things like esophagitis if that patient does have reflux. So we're going to look at the procedure that's being planned. We are going to think, how long is that procedure likely to go on for? The type of surgery that patient's having. Is it a surgical procedure? Is it a medical investigation? What's happening? Thinking about things through from that pre-med, what anticipated level of post-op pain are we likely to get? Do we want to use a pure or a partial opioid as part of our pre-med? Is hemorrhage likely to be a concern? If so, do we want to blood type this patient first? So if we do have issues in terms of hemorrhage, we know exactly what type of blood products we're going to give to that patient. Do we need to think about getting something in for a particular type of surgery? Have we got fluids available? Are we going to use fluid therapy to this patient? Are antibiotics appropriate for the procedure that they're having done? So lots of things we want to consider. What's that animal's temperament like? We're going to give that patient a pre-med based on that individual animal. So one pre-med for one type of procedure in a certain patient is going to be very different for the same procedure in a different animal. We want to tailor that pre-med to how that patient is on that day. Do we need any certain, specialised equipment at hand? Do we need more expertise for this procedure? Again, the breed, we're talking about Brachycephalics as part of this webinar. And also a really useful thing to do that can, again, help you think more about this patient is to assign an ASA score to this patient. So ASA is the American Society of Anaesthesiologists. They have a scoring system that ranges from 1 to 5, with 1 being patients that are normal and healthy, so coming in for routine things like spaying, neutering procedure, through to an ASA score of 2, with patients that have got mild systemic disease that is, well under control. That patient may not actually be on any medication, so it could be a patient that's had a fracture but they're not in shock. They've got a localized infection. An ASA score of 3 of a patient with more severe systemic disease, so maybe anemia, maybe dehydration. 4 is a patient that's got systemic disease that's a constant threat to life, so severely dehydrated, severely hypovolemic patients that are maybe in heart failure that are decompensating, through to a score of 5. With 5, these patients are going to die if we don't do something about it.